Hello again, it's Dr. Earl, and you're enjoying this video because you just had your first injection. And I'm excited to talk to you because I want to let you know what to expect as we move forward. And that's really the purpose of this video. Now, with this video, we created this so that you can pause, look at some additional information. There's a lot of things that we cover. And sometimes you need to spend a little bit more time, you have a few more questions, and it's included in the video. But we cover it so quickly that you need to pause or you need to go through it several times. Feel free to do that. Just quickly, I want to review what's in Renew O2. So vitamin B complex, this means all of the Bs, all 12 are in there. Dextrose, Nesicaine, oxygen, and excited oxygen. These play critical roles in reducing chronic inflammation, helping with collagen formation, really resetting the nerves, and then obviously the power play is oxygen, with the Nobel Peace Prize recognizing that it activates 300 healing genes inside of your DNA. Absolutely amazing. I've talked a little bit about this healing engine, and what is that? What really is the healing engine? Well, remember, inside of us we have DNA. That DNA put us together. That same DNA is still inside, and it just needs to be activated to put us back together after we've had injury or other issues. A lot of what we do in today's society actually blocks that healing engine and makes it so we can't put the pieces back together. That's the power of Renew O2, is being able to activate that healing engine and bring things back into balance. The 30 to 40 trillion cells inside the human body that are trying to balance out, and especially those in the area that's damaged or injured in your scenario, and we really need to try to activate that. Things that really affect healing: toxins, poor diet, nutrition, chronic inflammation, chronic disease, an aberrant pain signal, scar tissue, time, stress, nerve damage, immune dysfunction. I really want to talk about the degree and severity of damage as well. I left that, put it at first because it's so important, and I left it for the last to discuss. Because depending upon the degree of injury that you have, or degradation, really determines how long it's going to take you to heal. That makes sense. If you have severe disease, you may be looking at 9 to 12 months to heal. Truly heal. Now that doesn't mean that you're doing injections every 2 weeks during that entire time frame. My neck took 9 injections to heal, and it took 9 to 12 months to heal. And I did my initial package. Then over the next 6 months, I did 3 more. Not everyone gets away with doing just 3 more. I was doing a lot of things to really help my healing engine move forward. A lot of the things that we're going to talk about today. And so because of that, I was able to enjoy really good healing throughout that entire process. That's been 13 years. We're going on 14. And I have full range of motion, which I didn't have before. I have no pain, and I really do what I want with my neck. Quickly, I want to differentiate between acute versus chronic inflammation. Chronic inflammation has a lot of things that play into it, but the big issue is it sends an abnormal signal to your brain, and so it doesn't rally the troops in order to heal the process and get it better. It just continues the inflammation cycle, and it's really, really bad. The acute inflammation is actually part of the normal healing cycle. It's a good part of the normal healing cycle, and the reality is we use that to our advantage. So we're trying to block chronic inflammation, and we actually activate a little bit of acute inflammation. That's very important to understand as we look at this next slide, because one of the key points about what to expect is that if you are on this cycle of inflammation, and your inflammation is on the downward curve, and we do your injection during that downward curve, you may notice immediate relief of your pain, dramatic decrease in pain, swelling, warmth, because we're using that engine is already on the healing cycle, if you will. If, in contrast, you're actually upticking your inflammation just a little bit, then you may notice a little bit of increase in discomfort, pain, and increased swelling and stiffness. That's not a bad thing. In fact, in reality, the patients that experience that typically go on and do very, very well. So don't get discouraged, don't get downhearted because you're having an increase in pain and discomfort and a little bit of swelling and stiffness after the injection. Very normal. We're just tapping into the acute inflammation and turning off the chronic inflammation. So make sure that as you experience that, you realize, okay, this is supposed to happen. It may last for 6 hours, it may last for 24 hours, Very rarely will it go longer than 48 hours. And one of the things, if you look down in that right-hand corner, what things you can do to help with that, obviously apply heat for the first 24 hours. Why heat? Well, what we've found is that if you apply heat within the first 24 hours after an injection, it drives that nutrient, those healing molecules deep inside of your tissues and really helps move things forward. It increases blood supply, and that's absolutely critical. After the first 24 hours, you can start to alternate heat, then ice, or ice, then heat. It doesn't matter the sequence, and 20-minute intervals. So 20 minutes of heat, give it a pause for a few minutes, and then put ice on, or vice versa. Heat actually expands the tissue, so it brings in nutrients, it brings in blood supply, it brings in healing chemicals, and ice then contracts the tissue, which pushes out toxins and pushes out badness. So if you're alternating that, you're creating what's called a physiologic pump. The last thing we want to talk about with this slide is understand that everyone improves at different areas. And those areas can be sequenced differently. There are 4 main areas that the Renuo 2 will help your body improve. So pain, strength, stability, and decreased inflammation. And you may notice decreased inflammation, strength, and or stability long before the pain goes away. That's great. Everyone heals a little bit differently, but understand if you're noticing changes on any of these 4, your body has started the healing engine and it's well on its way to improving. That's exciting. What more can be done? Well, keep moving. One of the hallmarks and beautiful things about Renuo 2 is that where we're trying to build the tissues, we really don't have limitations as far as rest and so forth. We want you to be doing the activities that you did before. Now, we don't encourage you going crazy and suddenly coming and starting out an aggressive CrossFit program unless that's what you were doing before. So keep doing what you're doing. Maybe extend yourself just a little bit, but keep moving. Stretching absolutely aids in recovery. So if you can stretch the muscles and the tissues around the joint or your back or your neck or whatever is being treated, that will help that tissue recover and repair. In fact, if you think about it, one of the most agile and athletic and fast and amazing and strong animals on the planet are the cats. And that includes everything from tigers, lions, leopards, etc. They are amazing. Well, they don't go out and lift weights. They don't do those things. I'm not saying that's not healthy. Weightlifting is very healthy, but what I'm saying is there's big power in stretching. That's all these animals do is they stretch, and that keeps their bodies moving forward. So keep that in mind. Diet and nutrition is absolutely essential as far as getting better. We found that there are some key components in eliminating inflammation. So dairy, that's milk, cheese, creams, etc. If you're addicted to dairy or have some issues, we can talk about some alternatives. But try to get dairy out of your diet. Eggs. Now, not everybody has issue with eggs, but if you notice you have any kind of upset stomach with eggs, or if you really want to just maximize your body's ability to deal with inflammation, you may want to put eggs out of your diet for just a period of time. It's not forever. Sugars and simple carbs. Now, this is absolutely driving inflammation. It just is. Everything from insulin to cortisol and all the different components that sugars and simple carbohydrates drive. This can be paramount in helping you get better. Flours and gluten, obviously, this is a key component as far as getting better. And then poorly prepared rice and potatoes. Understand that potatoes, when they're uncooked, they're what's called a resistant starch. That means they're a complex, multi-joined carbohydrate. Rice is the very same. Once it's cooked, those connections actually release, and it becomes simple carbohydrates. And that is almost equivalent to sugar in your body. If you will then take that cooked rice or potato and put it in the fridge and cool it, those connections reform, and they reform in a very powerful way. And it once again becomes a resistant starch. That means that your digestive system has to break that down a little bit before your body's ready to use it. And again, that makes it much more healthy than if you just eat it right after cooking. So keep that in mind. The final thing about what more can be done, the best anti-inflammatory and supplements I've ever found is the trifecta from Actives: Link, Optimend, Genomics. If you want some more information about this trio, they work absolutely phenomenal. And give our office a call, and we can start to arrange getting that into your hands. In fact, I believe so much in it, we give away a bottle of the Optimend right during your first visit. Genomics is something called an NRF2 activator. Activates now, we found, up to 4,000 genes inside your DNA as far as getting inflammation down and really turning on that healing engine. Optimend is turmeric based. It's phenomenal as far as getting rid of inflammation, one of the most powerful anti-inflammatories there is. I use this in the place of ibuprofen. It's amazing. Link stops inflammation at the source. Most inflammation is actually sourced at the digestive system, and Link really drops and blocks that inflammation rapidly. Taking them together, because they work at 3 different areas, is absolutely powerful. Lastly, just keep moving forward. This is amazing. We have an amazing team. We look forward to getting you back to those amazing, fun activities that you love. And we're excited that you expressed some trust in Denali and our amazing team. Take care, and my best to you in all your healing, and we'll talk soon.